Hello everybody, my name is Dr. Tomcha Singh. I am working as senior consultant in the Department of Radiation Oncology, American Oncology Institute, Imphal branch. Our hospital is an oncology hospital, and as such, different types of cancer patients are coming to us for their cancer treatment. On many occasions, our cancer patients and also their relatives are asking us whether there is a need of having this COVID vaccination in the cancer patients. To clarify on these doubts in the minds of our patients and their relatives, this short video has been made. Before I come to the guideline of receiving this COVID vaccination, let me just give an overview of what this COVID disease is and what is the need of having this COVID vaccination in cancer patients. COVID-19 is caused by one RNA virus known as corona. It has been started roughly, 1 year before, and this particular virus has undergone a number of changes. We call it mutagenesis, and newer mutants or variants have emerged. The present mutants which are prevailing in our country are Delta and Delta plus variants. The main difference of the newer variants compared to the original ones is that the newer variants are more infectious. That means they can spread from one person to another much more easier. Supposing one person is positive in a family, there is every chance of infecting all other members of the family. Not only this, they also behave more aggressively, meaning that the disease symptoms comes very fast and even fatality also is increased. And so far, there is no specific treatment of viral infections, including COVID-19. All the treatment that is being given, all the medicines that are being given are the symptomatic treatment only, actually. So there is a need of giving some preventive treatment in the form of this vaccination so that immunity is being built on to the individual, and when the COVID disease comes, they can ward off the disease. On the other hand, cancer patients do have a weaker immune system. When the immune system is suppressed, the cancer disease comes actually. And coronavirus also finds it much easier to infect a cancer patient as the immune system is very much down. So there's all the more need of having this COVID vaccination in cancer patients. With this background, let me just go into the guidelines presently being followed for vaccination in cancer patients. What is the ideal time of having this COVID vaccination? Many of the patients do ask me. The most ideal time is before having any form of active cancer treatment. So treatments like radiation treatment, surgery, chemotherapy, etc., etc. So it is most ideal to complete this vaccination 2 weeks before starting a cancer treatment. Because 2 weeks after having vaccination, the immunity is kicking actually into the system. So patient become more resistant. Supposing before the treatment, vaccination has not been possible, still in the midst of treatment also, vaccination can be done. Say in the midst of radiation treatment, patient undergoing radiation treatment. At any point of time, we can have this COVID vaccination. But most appropriate timing will be one where the patient do not run temperature, no infections, the total leukocyte count is normal, not much suppressed, patient is not too weak, nor patient is not having very serious acute radiation reactions. So any time without these symptoms, we can give this vaccination in the midst of radiation treatment. Attempts should be made so that the radiation treatment is not disrupted. And we don't wish that the radiation response is compromised because of vaccination. So treatment should continue as usual without any interruption. With chemotherapy, same thing, during chemotherapy also, vaccination can be done. The only difference is we should not give the vaccination on the day of the chemotherapy administration. Because out of chemotherapy and also out of this vaccination, some symptoms like fever, mild pain, then some chills, some nauseating feeling, then some vomiting could come. And it will be quite confusing if the symptom come, provided we give on the same day. So it is ideal to give the vaccination at least 2 to 3 days after administration of the chemotherapy. Here also the patient should not be very weak. Patient's total leukocyte count should not be very low, and genuine condition should not be too weak also. During this monoclonal antibody therapy, another form of systemic treatment, we also call this treatment as targeted therapy, monoclonal antibody therapy. Actually, there is some interaction between this monoclonal antibody therapy and vaccination. It is said that monoclonal antibody therapy will compromise with the response to this in COVID vaccination. Immunity development will be suppressed actually. So it is not ideal to combine these two treatments. It's better that vaccination is finished before starting the monoclonal antibody therapy. This targeted therapy, sometimes we have to give for a very, very long time. In fact, it's to be given as long as it is effective to the patient. So it may last as long as 2 years, 3 years like that. And we cannot wait for to complete this before the vaccination. So it is better to complete vaccination before starting this targeted therapy. During immunotherapy, another form of systemic treatment, there is no contraindication combining COVID vaccination and this immunotherapy. The intention of both these two treatments is to build on the immunity which is happening. So they are complementary rather, they are advantages actually. And those who are having hormone therapy, there is no problem, anytime we can give the vaccination. Those who are taking steroids, especially high-dose steroid, it is not desirable to give this COVID vaccination along with this high-dose steroid because steroid can suppress the immune response of the vaccination. But if it is absolutely essential, with the consultation of the treating doctor, we have to see whether it can be given or not. Then during surgery also, this vaccination can be done, but like as in chemotherapy, we should not give the vaccination on the same day of the surgery. Because out of surgery, as a complication, infection may develop and fever and other symptoms may come. And because of COVID vaccination also, fever is a very common symptom if there is an adverse reaction. So these two will be confusing and management will be more difficult. Here also we allow at least 2 to 3 days gap to have the vaccination after the main surgery. Then lactating mothers, breastfeeding ladies, whether they can have this COVID vaccination or not. There is no problem in having this COVID vaccination in the lactating mothers. Some percentage of immunity out of the COVID vaccination may go to the infant also, to the baby also. This is rather desirable effect. There is no problem in this. In the case of pregnancy, the consensus is it is not desirable to give vaccination during pregnancy because the safety of the embryo or infant is not yet established as of nowadays, present the understanding. Only if it is absolutely essential with some amount of risks and with the consent of the treating doctor, we can consider. But in general, we should not combine these two forms of treatment. Whether cancer patients can donate blood or not. If the patients have received this COVID vaccination, not only the cancer patient, but in general, anybody who who had this COVID vaccination, whether they can donate blood or not. Yes, blood donation can be done, but a gap of at least 2 weeks we should wait after the COVID vaccination. Those who suffer from COVID disease, whether they can have vaccination or not, we should allow a gap of minimum of 3 months. And after 3 months, they can still have this COVID vaccination. There is no problem. So I think this explains most of the questions being asked to us. To summarize, the need of COVID vaccination is all the more needed compared to a normal individual because cancer patients do have a suppressed immune system. And there is no treatment of viral infection. As we all know, vaccination is the best form of preventive treatment actually. And the best time for having this COVID vaccination will be before starting any active form of cancer treatment But still, in the midst of treatment also it is possible, but we should combine, we should give on the same day this vaccination on the day of surgery or on the day of chemotherapy administration. Patients on high-dose steroid and monoclonal antibody therapy, it is better to avoid this COVID vaccination for the duration of the therapy time. With this, I would like to conclude today's video.